Welcome back to Sports Massage Therapy Education. Today we're diving into the world of trigger points, a key concept in sports massage. So sit back, relax, grab your snacks as we explore how to locate, understand and treat trigger points effectively. So what are trigger points? Well, trigger points are tight, hyper-irritable spots within a muscle. They're often going to feel like small knots and can cause referred pain. So that means pain that is felt in a different area than the trigger point itself. So think of them as a muscle's way of saying something's not quite right here. So how do they form? Well, they usually develop due to overuse, poor posture, or even emotional stress. So when a muscle is under constant tension, it struggles to relax fully. That's when a trigger point can form. So how do we find them? Well, when palpating a muscle, trigger points often feel like small tender nodules. So when we press gently but firmly, you're looking for a spot that's not only tender to touch, but might also recreate the referred pain that the client is experiencing. So now let's talk about how we're going to treat them. And the first thing we need to do is something called a 10-second test, which is going to identify if a trigger point will even be effective in that area. So we begin by applying firm, sustained pressure directly on the suspected trigger point for 10 seconds. During this time, we need to observe client's feedback. If the pain begins to decrease, you've identified an effective trigger point area. If the pain doesn't decrease, we may need to go back, strip the muscle and prepare it a little bit more and then retest until the pain does go down so we know that a trigger point will be effective. So there's two ways we can actually get rid of a trigger point now. The first is by applying pressure until the client feels discomfort at a level of around 7 out of 10. And what we're going to do is hold this pressure until that number decreases to around a 2 or 3. So we may be holding that for 30 seconds, we could be holding that for up to 2 minutes. Once that pain drops down to a 2 or a 3, we will sink in, go a little bit deeper and get that back to a 7. And we will repeat this 2 to 3 times until we are happy that that number has gone down and that trigger point has disappeared. The second of the two methods now is more of a pulsing technique. So what we're going to do here is again apply pressure until the client experiences discomfort of around a 7 out of 10. We're only going to apply this pressure now for around 10 seconds and then we're going to release and ease off for 2 to 3 seconds. Then reapply, get them back to a 7 and then again after 10 seconds ease off for 2 to 3 seconds and we'll repeat this process for approximately 2 minutes. After treatment, what you want to do is encourage your client to stay hydrated and perform gentle stretches. And that's a wrap on trigger points. If you want to watch the full video, please head over to my YouTube channel and we go into a lot more detail on these trigger points. And if you have found this helpful, don't forget to like, comment and subscribe. And as always, I will see you in the next one.